All right, my name is Rodney Powell. I'm the independent Medicare broker. I'll just tell you kind of what I do, why I'm here, which means that I don't work. Hi, welcome. Make yourself comfortable. So this means that I don't work for any particular insurance carrier, but I get to represent lots of different carriers. This is not a sales presentation. This is going to be an educational presentation. We're not mentioning any particular carriers. We're not mentioning any particular plans. We're just going to talk about Medicare conceptually, how it works. I'm going to explain to you the various parts of Medicare. I'm going to answer questions for you, even probably answer some questions you hadn't thought to ask yet. And this is going to be very informative. It goes for about 2 hours. It's going to feel like 20 minutes because we're going to cover a lot of ground real fast. So let's start out with what we call original Medicare. If you were going to bake an apple pie, you'd have to have some apples in your apple pie, right? If you don't have apples in your apple pie, you don't have apple pie. You got something else, but you don't have apple pie. You can think of Part A and Part B as the apples in your Medicare pie. You must have Part A and Part B before you have anything else. Part A is hospital insurance. All the stuff that happens in the hospital. Part B is medical insurance, and that's all the stuff that happens outside of the hospital. Now, I'm going to start by explaining Part B, and we'll come back to Part A. Well, let me explain one other thing before we go there. A lot of people assume that Medicare is free, and it's not. And the reason that confusion comes in is because Part A, if you've been paying FICA taxes for at least 10 years, your Part A premiums are already paid. Now, had you not been paying FICA taxes for at least 10 years, then there is a premium associated with it, and it's quite expensive. It's $505 a month for Part A hospital insurance. Part B, for most people, comes with a premium of $174.70 a month. Now, there are some exceptions to that. If you are a high-income earner, then you're going to pay a surcharge. That's called IRMA. I'm going to introduce you to two ladies that you probably don't want to know, Maggie and Irma. We'll talk about them later. But for the sake of this conversation, we're going to say the Part B premium is $174.70 for most people. All the numbers that I'm going to give you today, they go up over time. So we're taking a snapshot of what does 2024 look like, but 2025, 2026, 2027, and so on are all going to look different. So if we talk about a specific number, just keep in mind that it will go up over time. So Part B, your medical insurance, that's when you go to the doctor. And for $174.70 a month, the government insurance covers 80% of your doctor bills. Now, it's pretty good insurance in the grand scheme of things. The problem with it, though, is that it only covers 80%, which leaves you responsible for the other 20%. And there's no cap on that. There's no maximum on that. How quickly can you run up $100,000 in medical bills? Like that. Very quickly. Well, I can tell you that my wife had emergency hernia surgery this past year, and within a week we were at $70,000. That's how quickly it could happen. My eldest son, some years back, had a serious automobile accident, had $1 million in medical bills. That will scramble your nest egg. So you need to mitigate that exposure somehow. And you're going to do it in one of two ways. You're either going to go with an Advantage plan, or you're going to go with a Medicare supplement, also known as Medigap. And we're going to call it Medigap today because there's fewer syllables. Let's begin by talking about Advantage plans. One of the reasons why you might want to have an Advantage plan is because these plans come with a maximum out-of-pocket, MOOP, maximum out-of-pocket, which means if things get really bad on you, we're going to draw the line somewhere. The insurance company is going to pick up everything after some point. These Advantage plans, if you go to a provider, if we're talking about doctors or we're talking about hospitals, we call those providers. If you go to a provider, they don't typically refer to them as Advantage plans. They refer to them as replacement plans. This is also called Medicare Part C, but it's a little bit of a misnomer. Medicare Part C, they're sometimes called, which is a little bit of a misnomer because they're not actually provided by Medicare at all. They're provided by a private insurance company. What happens is the private insurance company takes over what Medicare is doing for you up here and provides A and B plus a bunch of extra stuff. Now, these plans typically have a zero premium. They may have a small premium. The most common ones, unless you're kind of in a remote area, usually come with a zero premium, which makes them very popular. So some reasonable person might say, well, why is there a zero premium on that? There's got to be a catch. And there is, kind of. So the government makes a deal with the private insurance companies and says, we will give you a certain amount of dollars per capita for each person that you enroll in your Advantage plan, as long as you can provide coverage that is equal to or better than what we're providing for them up here. So they make a deal. And the private insurance company sweetens the deal to attract people to their plans. And so they're going to bundle some extra supplemental benefits with that. One thing that commonly comes with these is Part D prescription drug plans. And also, you might see these with dental, vision, and hearing. So if you see the D, V, and H on here, that's what we're talking about, is dental, vision, and hearing. And then you might have other things like a fitness membership, or if you've ever seen a commercial with Joe Namath or J.J. Walker or William Shatner late at night, and they're telling you all the great stuff that you can get for no cost to you, that's what they're talking about, is an Advantage plan. And that's why so many people are familiar with those. So like, great, that must be what everybody does. And it's very common for me to hear from people that, wait a minute, you're telling me about these Medigap plans over here. I don't have any friends that are on Medigap. So why are all of my friends on Advantage plans? Well, the reason is because all their friends didn't get the whole story. They didn't come to a class like this and get all the information up front so that they can make an informed decision. Both of these are valid options. You're not going to mix these. This is the fork in the road right here. You're going to go one way or you're going to go the other way. You're not going to mix them, but they're both valid options. It just depends on what your needs are. Now, I have a bias about this, I'll tell you. If my wife and I were to get on...
It's a little bit, I miss a few things here and there. What was that last?
That both of these are valid options. So it just depends on what your needs are. Okay? So if I seem to favor a Medigap plan, that's because I think there's some wisdom behind that. And I'm going to tell you what that wisdom is. But that's not going to work for everybody. An Advantage plan is going to be the solution for many people. And it's going to be the preferred solution. Y'all remember that commercial a long time ago that Apple and Microsoft had these commercials going, I'm a Mac, I'm a PC? You're old enough to remember this. Y'all are all old enough to remember this. This is a Medicare class. So these commercials, I'm a Mac, I'm a PC. And you're going to identify with one of these. You're going to say, I'm an Advantage person or I'm a Medigap person. And I won't have to tell you. You'll figure it out on your own. So let's talk about what these plans cover. No, before we do that, we want to talk about enrollment. So a lot of you are turning 65 real soon. And the reason you're here is because your birthday is coming up. And you're going to have your initial enrollment period. Now, the initial enrollment period is for 7 months. It's going to be the 3 months before your birthday, and it's going to be the 3 months, your birthday month, and then the 3 months after your birthday. And if you enroll in Medicare before your birthday, it's going to take effect on the first day of your birthday month. Somebody give me a birthday. February. Okay. So her birthday's in February. She's got January, December, October, November. Right. You count backwards. It's hard to do that backwards. Okay, so anytime after November, she can enroll for a start date of February the 1st. And if you enroll after your birthday, then it's going to take effect on the first day of the next month after your birthday. If you enroll in here, you will not incur late enrollment penalties. And one of the big reasons that people come to this class is, all my friends told me I was going to have late enrollment penalties if I don't get on a Medicare, but I'm still working. So that raises another question. And that is, do you need to enroll in Medicare if you're still employed? Maybe. You've got options. So,
Well, that you had to enroll in Medicare.
maybe not.
65. I thought that was a rule.
So, let's address that. There's nothing that says that you have to enroll in Medicare at all. There's no law that says that you have to enroll in Medicare. You can enroll in Medicare if you want to. You can not enroll in Medicare if you don't want to. You can enroll in part of Medicare if you want to. All of Medicare if you want to. But if you don't enroll in Medicare when you should, and then you decide that you're going to later, then you'll have late enrollment penalties. And I'll get into the late enrollment penalties.
That's how they get you.
Yeah. So now, if you are actively employed with a company that has 20 or more employees, and you have coverage, health insurance coverage through that company, it's what we call creditable coverage. Creditable coverage is coverage through your employer of 20 or more employees that is equal to or better than what Medicare would provide you up here. And that's most commercial plans. Most group health insurance plans would be creditable coverage. If you are self-employed or you're on an ACA plan, you work for a small company that has fewer than 20 employees, then you need to go ahead and get on to Medicare now. There's some things that people assume might be creditable coverage that are not. COBRA is not creditable coverage. VA is not creditable coverage. Believe it or not. You got government's own health care plan is not creditable coverage. We're going to talk a little bit more about that. There's another way that you might qualify for, there's a couple of other ways that you might qualify for Medicare besides being 65. One is if you have been on Social Security disability for 2 years. And the 25th month after you've been on Social Security disability, you qualify to get onto Medicare. If you have certain diseases like Lou Gehrig's disease, end-stage renal disease, renal failure, then you could qualify for Medicare. Also, when you're not quite 65. If you still work for a company and you're keeping your company insurance, at some point you're going to retire, and then you're going to need to go to ssa.gov. There it is, right there, ssa.gov. That's where you enroll in Medicare. ssa.gov. And you're going to need to show them some proof, some evidence that you've had creditable coverage during all that time, so you don't get the late enrollment penalty. So how do we do that? It's pretty simple. There's a form called an L564. If you're making notes, you want to write that down, L564. Your HR department will probably be familiar with this already. If for some reason they're not, you can download it online, L564. It's a CMS form. And if you still can't find it, ask me. I'll email it to you. It's a PDF file. And all they're going to do is fill it out and say, you had coverage with this company between this date, and they're going to sign it, and you're going to give it to Social Security, and everybody will be happy. Yes, sir.
What about some Medicare.gov? They send emails asking you to enroll in that kind of thing. That's not a government.
Yes, it is. Yeah, Medicare.gov is. Medicare.com is not. So heads up about that. Medicare.gov is the real deal. And ultimately, it's going to lead you to here, though, for enrollment, ssa.gov. You can enroll in person if you want to. Some people are more comfortable doing that. Getting an appointment to get in to see Social Security can sometimes be an ordeal. You can do it on the telephone also, but you've almost got to be retired to do that because you're going to have a lot of time to wait on the phone. Health savings accounts. Let's talk about that real quick. Anybody got a health savings account? HSA? Okay. So you need to discontinue making contributions to your HSA at least 6 months if we're taking any part of Medicare. And that includes Part A with no premium. A lot of those people will take Part A and not take Part B. Like, I'm turning 65, I'll go ahead and take Part A. It doesn't cost me anything. I'll go ahead and get on it. And their employers kind of like that because they can offload responsibility for their hospital coverage onto the government instead of their insurance having to do that. But if you're taking Part A, you don't need to be making contributions to your HSA because you will incur penalties with the IRS down the road. Okay, let's talk about what Part A helps to cover. Helps to cover hospital and skilled nursing. That SNF up here stands for skilled nursing facility. It helps to cover inpatient labs, imaging, and testing. This is stuff happening in the hospital. Covers some blood transfusions, and it helps to cover hospice care. So if you're in the hospital, it's going to cover a semi-private room. It's going to cover meals. Nothing says recovery like green jello, right? Part B helps to cover doctor visits and ambulatory surgery, ambulance and ER, outpatient labs, imaging, and tests. And here's something I want to make sure that y'all take away with you today. It helps to cover infusion meds and chemo. A lot of times people think chemo and infusion meds, that's drugs, that's Part D. No, that's a Part B. If it's administered in a clinical setting like that, they hook you up to an IV and give you the drugs, that's a Part B thing. Yes, sir.
You say Part A hospital is losing 100%?
It doesn't. And I'm glad you asked that because that's what we're going to talk about right now.
Because the other one is 80%, but Part A.
Yeah. So how would this work? Let's say you don't have any of this down here. You're on original Medicare only. We're looking at the top of the board here. And you have Part A coverage. You need to go to the hospital. First time when you get admitted to the hospital, it's going to cost you $1,632. That's the price of admission. Does not matter which hospital that you go to. If you go to Memorial Hermann, you go to Methodist Hospital, you go to St. Luke's Hospital, you go to HCA Hospital, doesn't matter. It's going to be $1,632. And that is not an annual deductible. That's a deductible per benefit period, which begs the question, what is a benefit period? A benefit period begins when you're admitted to the hospital and it ends 60 days after you're discharged from the hospital. So, do we have any engineers here? Could we have more than one benefit period in a year? How many benefit periods could we have in a year?
6.
In a leap year, that's right. It's mathematically possible to have 6. In a normal year, it would be 5. If you have to do this more than once, though, that's really going to be a drag. It's like, I got out of the hospital, go back in, even if it's for the same thing, you got to pay the $1,632 again if you've been out of the hospital more than 60 days. Now, if it's been less than 60 days, you can go back and you don't have to pay the deductible again. Days 1 through 60 in the hospital cost you $0 because you paid your $1,632 deductible over here. That's a pretty good stay in the hospital for $1,632. You're definitely getting your money worth there. If you're really sick and you're in the hospital for more than 60 days, the next 30 days is going to cost you $408 per day. They're going to start charging you rent then. Now, let's say things are really bad and you're in the hospital more than 90 days. At that point, you're going to throw down a wild card. That's your lifetime reserve days. Now, everybody who's got Medicare Part A has 60 lifetime reserve days. Use them wisely. You can use them all at once if you want to. You can use some now, you can use some later, but just use them wisely because you're only going to get 60. And they cost you a little bit more too. Those days are going to cost you $816 a day. So this unfortunate person...
I'm sorry, $816
per day.
per day.
Yeah. Which is still better than full retail. But for this poor person who's been in the hospital for 150 days, if they leave on the 150th day, they're going to leave with about a $62,000 hospital bill. Now, let's say that's an unlikely scenario. I just want you to understand how it works, okay? Let's say, though, that they're not going home from the hospital right now. And a good scenario for this would be someone who has a stroke. You go to the hospital, you're in the hospital for about 3 weeks, and then the doctor says, you don't need to be in the hospital anymore, but you're not really ready to go home. So the doctor refers you to a skilled nursing facility. First 20 days in a skilled nursing facility will cost you $0 because you paid your $1,632 over there. The days beyond that, from 21 to 100, cost $204 a day. Now that's going to tap your your savings account a little bit there if that happens to you. So for that reason, this could be an expensive scenario. You need something else. Even if you just get the zero premium Advantage plan over here that gets you a maximum out of pocket, draws the line somewhere so this doesn't happen to you. These Advantage plans come in the various flavors, some of which you're familiar with. Everybody knows what an HMO is, right? Health Maintenance Organization, to managed care. The HMO plans have a fairly low maximum out of pocket, typically between $3,500 and $4,500 for the year. That's pretty good, as long as you're willing to play by their rules. Okay. A PPO gives you more flexibility. Now, a PPO has a network, and you're going to go to the doctors in their network. That's where you're going to get the best deals, but you do have the flexibility of going outside the network. There's a financial trade-off that people make when they do that, though. And one of those financial trade-offs is that the maximum out of pocket is higher on a PPO plan. And we typically see these in the $7,000 to $12,000 range. Those aren't the official numbers, and it depends upon the plan, but that's about where they come in on PPO plans. And if you go outside of the network on a PPO plan, which you have the flexibility to do, it's going to get very expensive for you. You're probably going to have co-insurance of 40 to 50% of the cost of the services that you're receiving. So you're going to probably need that maximum out of pocket of $7,000 to $12,000 because you're going to be hitting that cap at some point. I sometimes tell the story of the gentleman that works at an auto parts store that I frequent. He's in his late 70s. And we were talking about his Medicare one day. And I said, well, so what are you doing? And he says, oh, I've just got original Medicare Part A and Part B. And I said, well, you need to come to one of these things. Let's talk about it. And I said, you ought to at least have an Advantage plan so that you've got something here protecting you. Oh no, I don't like those networks. I don't like dealing with all of that. And it fell on deaf ears, and it really troubled me. I went back some weeks later and I talked to him about it again. Same thing. He didn't listen. And the sad thing is that if something happens to that gentleman, he's in his late 70s, it's very likely he could land in the hospital for an extended period of time. It could bankrupt him. You know, about 2/3 of bankruptcies are medical bankruptcies. And it's completely avoidable. All you need is the information. Enroll in one of these Advantage plans, and you've got some protection there. Even if you don't like how they work, none of these are perfect, I'll tell you that. There's no perfect solutions in there. But it's a good solution. It's something that will protect you. You just need to take the right steps to do it. And it's not hard to do. Talk to me about it. I'm here to help you with that.
I don't understand. It costs zero.
It cost zero on the front end. The premiums were zero. Now, I'll tell you, when you sign up for one of these, in a sense, you're kind of making a deal with the devil, because you've got to play by their rules at that point. That means that you're obligated to work with their networks. You're going to have a primary care physician, and you're going to take referrals. So if you want to go see a specialist, your primary care physician is going to refer you to a specialist, so that they've got some controls over how you're utilizing this plan. And here's the big thing. Well, even before I get there. So they're going to get their money through out-of-pocket costs. Deductibles, co-payments, and co-insurance. They're going to get their money on the back end whenever you're using the services. If I have an earache, and I'm on an Advantage plan, my wife says, I'm not on an Advantage plan, but let's say I was. My wife says, you need to go to the doctor and get your ear checked out. Okay, it's not going to cost me anything to see my primary care physician, or it might cost me $20. So I go see my primary care physician. The doctor looks at my ear and says, I don't see anything, but I'm going to go ahead and send you to this specialist over here and this specialist over here and let them check things out. So I go see the specialist. That costs me a little bit more. So their copays are higher, maybe $30, $35. And this specialist over here says, I'm looking at that. I don't see anything. But, sometimes an earache could be a sign of a tumor. Maybe I'd like to order some imaging. Let's do an MRI and take a look at it. Okay, I've got a procedure going on now. Guess what? That procedure's got a copay. And this doctor over here takes a look at me, says, I don't see anything, but it could be a sign of an infection. Bacterial infections are pretty easy to detect. Viral infections are a little bit harder. Let's do some blood labs. So now I've got another procedure going on. Guess what? That's got a copay. Every time that the carousel goes around, they're collecting a copay from me over here. Now my little earache that I thought was going to be $20 is costing me hundreds of dollars. And then I've got to go back and somebody's got to interpret all of that stuff and then prescribe me some meds, and we've got to figure out what we're going to do with it. So they get their money from you one way or the other. You will pay for this at some point, but you're going to pay for it as you use it. The difference is paying in advance versus paying as we go. And I haven't really explained how this works yet for you to appreciate that. But one of the big deals about this is prior authorizations. And that means that the insurance company gets to decide what procedures that they're going to pay for. Over here with a Medigap plan, your health care is between you and your doctor. Over here, it's between you and your doctor and your insurance company. And for me, that's a deal breaker. Now, some people, they're totally okay with that. And if so, that's fine. There's many people do this. In fact, about half of the people in the world, or in America, that have these plans do Advantage plans. And about half of the people say, I want a Medigap plan. I just want you to know what your options are over here. Now, yes, sir.
You can have Part B and Advantage, or
you will have Part B. It takes over, but you're still going to pay your Part B premium. So you don't stop paying your Part B premium when you go into an Advantage plan.
a doctor, then you pay 20%.
When you go to the doctor with an Advantage plan,
the medical Part B. You go to a doctor. You have to go to your primary first. Yes.
If you just have Part B by itself, you can go to any doctor that accepts Medicare.
Okay. So, but then you add Advantage, and then that sounds like that restricts you to do something.
That's correct.
Where even though you have Part B, that you can go directly to
There you go.
a skin doctor.
Yes.
Advantage says, no, you can't. You have to go to your primary.
Yes, exactly. That's exactly right. You got it. Okay. So what does Part A and Part B not cover? It doesn't cover prescription drugs. It doesn't cover dental, vision, and hearing. That's routine dental, vision, and hearing. There are certain dental, vision, and hearing procedures that are covered, like cataract surgery gets covered. But routine dental, vision, and hearing is not covered. It doesn't cover long-term and custodial care. So if you're counting on Medicare to be there for you when you need a nursing home, it's not going to be there. What is custodial care? Custodial care is activities of daily living. So things we all have to do, like we have to get dressed, we have to bathe, we have to eat, things like that. Medicare doesn't help you with that kind of stuff. Now, if you need home health care, it does help with that sort of thing. And that's good. If a nurse comes to your home and gives you meds, administers meds, changes your bandages, and goes and leaves, Medicare will help you with that. But there is such a thing as home care, where somebody who looks like a nurse comes to your home and helps you with stuff like getting around and bathing and changing clothes and stuff like that. Medicare doesn't pay for that. That's a completely different thing. And if you think that that's something you're going to be contending with at some point, we need to have that conversation. There's other solutions for that, and I can help you with that. It's not a Medicare thing, though. Yes, sir.
What about a family member taking care of you at home? So when they get paid for taking care of you at home?
No.
Not a tax of it.
Yeah, this is a federal program. And so
That in California, that the daughter was taking care of the mom and she was getting paid $2,000.
yeah, so I'm not familiar with California, but perhaps it could have something to do with their state programs.
The state.
Yeah, like and it's a good thing you should bring that up, because in Texas we have Medicaid. Sounds a lot like Medicare. It's a state program. Medicare is a federal program, and this is for people who are older or have certain medical conditions. Medicaid is designed for people who have very limited resources. And so they're two separate programs. I don't really deal with Medicaid, but they sometimes work together. So you want to make sure you don't confuse those, though, and keep them separate in your mind. So this $174.70 a month, if you are taking Social Security, they'll deduct that from your Social Security check, and it's typically taken out on a quarterly basis. That first time that somebody gets hit with 3 months at a time, they're like, whoa, what is this? Yeah. Now, I suggest that if you're not taking Social Security right now, that's great. Postpone it for as long as you can, max it out. But if you're not taking Social Security and you want to go ahead and get on to Medicare, then have it set up on what they call Easy Pay. And that's a direct draft from a bank account. Now, some people say, oh, I don't want anybody taking money directly out of my account. I get it. I'm old school too. I'm like that. But this, you know how much this is going to be. This isn't like setting up your power bill to be paid where you don't know how much it's going to be. You know how much this is going to be every month. And there's some very good reasons to do that, because sometimes things happen and that bill doesn't get paid. And everybody who does what I do could tell you a story about somebody who is in the hospital for an extended period of time. That bill is sitting out in the mailbox and it doesn't get paid, or it gets lost in the mail, and they don't think about it. And if your Part B lapses, all the rest of this stuff unravels. So remember, this is the apples in your Medicare pie. You got to keep that Part B paid. So set it up on Easy Pay, do the direct draft, get it paid. Let's talk about Maggie and Irma. So Maggie is your modified adjusted gross income. And if you file taxes individually in 2 years prior to the current year, your modified adjusted gross income was in excess of $103,000. If you file taxes jointly, then your modified adjusted gross income was in excess of $206,000, then you're going to pay more than $174.70. And there's 5 levels of this. There's 5 tiers of this, and it can get to be very, very expensive. The next bracket up from this, from $174.70 is $244.60. And it goes all the way up to $594 per person. So that can get very, very expensive. Now, I have a friend who was in the oil and gas business, did very well in this business, and got onto Medicare. And sure enough, he gets a letter that says, we need to introduce you to Irma, Maggie's friend Irma. Irma is the surcharge. We're not supposed to call it a penalty. Feels like a penalty, but call it a surcharge. It's a privilege to pay the extra. And so he appealed it. It's a very simple matter to appeal this, by the way. I've helped several families do this successfully. And he said, yes, indeed, I was making that income 2 years ago, just as you said, but I'm now retired and I'm not making the same kind of money that I was before. Therefore, that would be a hardship on me. I have a change of life. That's what they're looking for, is a change of life. Your change of life could be the loss of a spouse. And so if any of these sorts of things are part of your world, talk to me later. Call me up. You've got my phone number. Call me and I will help you with that. And we'll get that thing appealed. And often it's successful. Can't guarantee that, but often it's successful. Let's talk about late enrollment penalties. Part B has a late enrollment penalty. It's 10% per year for every year that you could have been on Part B, that you were not on Part B when you decide to get on Part B later. I'll tell you how this comes up most often. It's usually with veterans. Yes, a guy served in the military, gets to be 65, and he says, I don't want to pay $174.70 a month. I have VA benefits. I'm 65. I feel good. I hardly ever go to the doctor anyway. And why would I want to pay $175 a month? And they just blow it off. They're just like, Medicare doesn't even happen. And let's just say about 3 years down the road, they're complaining to one of their buddies about the VA. It's very common. And their buddy says, well, why don't you get on the Medicare? Because I didn't want to pay $174.70 a month. Well, you don't like what you're doing now, So why don't you go ahead and get on Medicare? Well, I get the call. I'd like to get on Medicare. Great. It's $174.70 a month plus 30%. 3 years times 10% for all the years that you were not on there that you could have been on there. And guess what? That penalty is for life. Yes, it is not a one-time penalty. And if you think about it, all these numbers go up over time. So what's $174.70 today might be $200 next year. Might be more than that the year after. That 10% penalty is going to escalate right along with that premium. So if you think you might want to postpone that, remember, veteran benefits are not creditable. COBRA is not creditable. Yes.
Why would you not take the two together?
Why would you take only A okay, so if you work for a company, you're continuing to work, you might want to go ahead and take A. In fact, your employer might want you to take A. And that's something I always encourage people to talk to their benefits department about and just see if there's some fine print in your group health policy that says if you're eligible to take A, that you're going to take A. Otherwise, you're responsible for your hospital part that A would pay for. So check the fine print, check with your HR people. You might as well enroll in A. There's no reason not to, except for the health savings account issue. And that's a big deal for some people. Let's talk about prescription drug late enrollment penalties, because they have a late enrollment penalty also, and that's calculated a little bit differently. It's 1% per month for every month that you could have been enrolled that you weren't enrolled. And what trips people up a lot of times with this is, I'm not taking any drugs right now, so I don't need a drug plan. Or I get my drugs with GoodRx. Well, we love GoodRx. We're going to talk about GoodRx. We love our GoodRx. It's very helpful, but it's not creditable coverage. Most of these drug plans are in the $50 to $100 range per month. Yes, sir.
56 to 100. I pay 56.
80% of the ones, the standalone prescription drug plans that we have written this year were 50 cents a month. So, yes. And I don't expect that to be the case next year. It's a very aggressive marketing move on the part of one of the carriers in order to get as many people. They're taking a loss on this in order to get as many people on board as possible. So if that plan goes away, then they have the privilege of contacting you and saying, guess what? We've got another plan that we can offer you. And so they upsell you to another plan. Now, we talked about these Advantage plans having networks. And as people are reaching retirement age, they're like, well, I don't think I want to do that because I'm planning on getting in my RV and going traveling a lot. We want to take some vacations and stuff. And so they're a little bit reluctant to do that because they're traveling. Well, they give you emergency coverage anywhere in the United States. So if you're vacationing in Montana and you get bit by a bear, go to the emergency room. They'll sort it out later. You go to the emergency room, you can go to urgent care. Also for dialysis, anywhere in America, that would be covered under your Advantage plan, even though you have a local network. Let's talk about prescription drug plans. This is where it gets interesting. We're going to spend a lot of time on prescription drug plans because you guys are you're going to figure out all of this stuff. Actually, before we do that, I want to finish talking about Medicare, Medigap. And then we're going to talk about prescription drug plans because those are very, very much more involved. And it's going to be the part that you continue to deal with on an ongoing basis. You're going to figure out all of this stuff. You're going to set it and forget it. Prescription drug plans, you're going to deal with on an ongoing basis because your prescription drug needs are going to evolve over time. And these plans change every year. So you're going to want somebody to come alongside you and check on you once a year. Say, hey, how's your plan working out? What drugs are you taking? Got any new prescriptions? You dropped any prescriptions? Let's take a look at next year's plans and make sure that what you're on is still the best fit for you. In your case, for example, with the 50-cent plan, you definitely need to have somebody to look at it. In fact, I'm going to explain to you before we're done today why everybody in America who's on Medicare needs to have their prescription drug plans looked at this next year, this fall. Yes, ma'am.
You talked about emergency care being provided under the Advantage. What about under Medicare?
Let's talk about it. Glad you brought that up. Okay, so these plans are guaranteed issue, which means that it doesn't matter. The Advantage plans are guaranteed issue. Doesn't matter what your health conditions are, we can get you onto an Advantage plan. So they're not going to decline you because you've got heart disease, because you've got diabetes, because you've got cancer, anything. We can get you onto an Advantage plan. No problem. Medigap plan, different story. Medigap plans are subject to what they call medical underwriting, which means that they get to ask you questions about your medical history, and they will check on it. They have what they call a medical information bureau. It's kind of like a credit report, except they check on your health report and on what prescriptions that you have. And they're very good at tracking those things down. And so they're going to check and see, you got anything that we might want to disqualify this person over. So it's one way to get onto a Medigap plan. The best way to get onto a Medigap plan is when you first enroll in Medicare Part B, because you get a 6-month open enrollment period when you first enroll in Part B. Now remember, I said when you enroll in Part B, not when you turn 65. So when you enroll in Part B, that's when the clock starts ticking. You can get onto any Medigap plan that you want to, no questions asked. Now, after that, if you want to get onto a Medigap plan, you're going to have to answer medical questions. You're going to have to pass medical underwriting. I get people sometimes that say, I'd really like to get on the Advantage plan because it's 0 premium and I get all of these extra benefits over here, and I'd like to ride that horse as far as I can. And then when I get sick, then I'll come over here and get onto the Medigap plan. Then we get onto the Advantage plan over here. And then they want to move back to Medigap. Well, it doesn't work because at that point you're sick and you can't get over here. Yes, ma'am.
And you said that that's within 6 months of when you sign up Part B.
Part B. Yes. That's when the clock starts ticking. Now, these come as though the A's and the B's and the C's and the D's and everything on here wasn't confusing enough. These come with letters also. And the one that you're probably going to focus on most is what they call a Plan G. I can just tell you there's lots of different plans. Some of them have been retired, but most people enroll in a Plan G. And I'm going to talk about some of the different flavors of Plan G. There's a Plan N that's fairly popular, but it's going to have copays that come with it, and you also have to pay what they call excess charges, which could lead to some surprises. And look, people who are Medigap plans, they don't want to deal with any of that. They're like, I just want to know I'm paying my premium and I'm covered. Because the cool thing about these is if you're on a standard Plan G, you go to the doctor, you pay a $240 deductible the first time that you go to the doctor, and after that, you can go as much as is medically necessary. It's like having a season pass all year. You can go to the doctor. And you can go to any doctor that accepts original Medicare, which is like 97% of them. You don't have to ask permission. You make your own appointment and you go. My mother is turning 80 years old this year. She has a Medigap plan. Someone wisely put her on one years ago. And you couldn't pry it away from her for anything. And her premiums have escalated. She pays a lot. I don't know how much she pays. She doesn't talk to me about it. I'm guessing at 80 years old, she's probably paying $400 a month or more for her plan. But she still would not give it up for anything because she goes to this doctor and this doctor and this doctor. She goes as much as she needs to. That's a little bit of a problem because this doctor and this doctor and this doctor don't always know what the other one is doing. And it would be really nice if they were all working off of the same electronic medical record. So that actually is one of the reasons why someone might want to be on managed care over here, is because they've got some coordination of care. Hers is kind of willy-nilly here and there, and that's a bit of a problem. She doesn't hear so well at 80 years old. My wife sometimes goes to the doctor with her, and the doctor consults with her. Doctor walks out of the room. My mother gives a completely different account of what just happened, because she only heard about half of it. But she loves her Medigap plan. a Plan G is the most popular plan. And as far as the premiums go, I use the example of a male non-tobacco user in Texas, because this is just sort of the benchmark that I work with. At 65 years old, those premiums are probably going to be somewhere in the neighborhood of $150 a month. Could be more, could be less, depends on the plan. They're going to go up over time. So 66, 67, 68, 69. Oh, by 69, you're probably looking at about $200 a month. And they just keep going up. And that means that one of the things that you really want to pay attention to when you're getting one of these plans is whether that company has a history of maintaining stable rates. There's two reasons why these rates go up over time. One is medical inflation, which is a very real thing right now. Two is because of age-rated increases. Costs more to insure a 75-year-old than it does to insure a 65-year-old. And so they go up over time. There's a company I like a lot that does this, that will treat you like you're 65 until you're 69. Nice. That helps to keep things nice and level. One thing that I can tell you is that you don't have to get too focused on the name brands on here, because there's a saying, a Plan G is a Plan G is a Plan G. They're standardized by the government. So you don't have to go ask your doctor, do you take my Plan G from this carrier? It's not like the Advantage plans where you have to say, okay, do you take this plan or that plan? Or are you in network on that? It's just, do you accept original Medicare? Yes. Okay, great. You show up with your Plan G, and it doesn't matter if it's from Company A, Company B, or Company C. So what we care about is this company going to treat you right over the long term? Because you're going to be real committed to this. You're not going to be changing these plans. You'll change these plans maybe every year or every few years or something, these Advantage plans, but your Medigap plan, here, this will make this easy to remember. I've got the A's, B's, the C's, and D's in here. I got an M up here from Medigap. There's not a plan M, but I just had blocks everywhere else. But M for Medigap, M is you're going to marry your Medigap plan. You're going to get that baby and hold on to it. As long as you pay the premiums on your Medigap plan, they can never drop you. Doesn't matter what medical condition that you have, they can never drop you. D, for drug plans, you're going to date your drug plan. Okay? Because those plans are going to change from year to year to year, and your needs are going to change. And so that needs to be revisited from time to time. By the way, if you go this route, none of this includes dental, vision, and hearing. So you need a separate, at least dental plan. I'm not a big fan of vision and hearing plans, by the way. So make a note of that. I think that most of them are just not a good deal. They're what we call dollar swapping. You're paying $1 in premiums for $1 in benefits. And I'm big on paying cash. I look a little bit like Dave Ramsey. All right. You know, I show up and I say, hey, we're paying cash today. The magic words, we're paying cash. You get a special rate today. In fact, I'm going to the dermatologist tomorrow. Guess what? I'm paying cash. And I'm going to get the special rate tomorrow. So, medical inflation. Let's talk about that real quick, because a lot of these are taking a real spike this year. So medical inflation was tracking along real nicely. This is just kind of a little side note that I think you'll find is interesting. COVID lockdowns. What happened? All the demand dropped off. People were staying at home. And medical procedures, elective medical procedures, they postponed those things. Like, I can't go to the doctor right now. So that was great for insurance companies. They're still collecting premiums and nobody's using the services. Well, things loosen up and guess what happens? Big spike in demand. All those things that people postponed, they can start going to the doctor. Well, now the insurance companies are reeling. They're like, whoa, all these people are using our services now. They're using our plans and it's costing us money and we're losing money. And so we've got to raise your premiums. It's kind of like when a hurricane comes through. You know, oh, had a hurricane, we got to raise your premiums. Same thing. Insurance companies are greedy. I'll just tell you. They don't know. And they are out for themselves. I don't care what they tell you, what their ads say or anything. They don't care about you. They care about their shareholders. And they're in the business to make money. Now, your trusted independent Medicare broker may care about you. Your doctor may care about you, but your insurance company, they don't care about you. Your providers really like these plans. If you talk to doctors, they'll probably tell you, if I could have all my patients on this side of the board, I would be really happy with that. Because this is kind of a hassle for them. It's extra overhead. They have to get those prior authorizations. They have to ask permission to do stuff. Doctors are human, you know that? And they would like to do what's in the best interest of their patients. They don't want to have to ask an insurance company. And, if the insurance company, even if there's such a thing as denials, and even if there's nothing nefarious going on, okay, they're not sandbagging. It's still some friction in the process. It still slows things down. And look, delayed medical care has consequences. So if you can avoid this, you would want to. And so the doctors like these Medigap plans. They like to be able to call the shots. There's a high deductible version of this plan G. And right now in 2024, this has a $2,800 maximum out of pocket. They call it a high deductible. It's really maximum out of pocket, $2,800. No, that brings the premiums way down. From that same male over here, premium might be about $60 a month. For a female, females always get better deals on these premiums. They're probably going to be $45 to $50 a month. Sounds great when you're 65 and you're healthy. When you're 75 or 80, and I always try to get people to think down the road. Think about your future self. You're 75 or 80 years old, and you're going to the doctor all the time, and this is no longer $2,800, but it's $5,000, $6,000, $7,000, whatever it is down the road. That's going to be a drag. You're not going to want to do that. So I don't think that this high deductible is a good long-term strategy to say the difference between this premium and this premium. There's one carrier that I really like that has a hybrid version of this. And if you're willing to take a high deductible for the first 3 calendar years, then after that, it drops off and it becomes a standard plan G, but you're going to get a discounted premium for life. I like that math. I like that a lot. In fact, if my wife and I were going to get onto Medicare today, that's what we would do. And we're very much looking forward to getting onto Medicare. That'll be the best insurance that we've ever had in our lives. So it's going to be a good thing. All right. Let's talk about prescription drugs. Yes.
Find a hybrid.
What's that?
Having find a hybrid.
You call me.
Who's in the hybrid person?
Yes. Yeah. Okay. So that's what I do for people. I mean, that's how I get paid. I get paid by the insurance companies. So if someone needs help with these things, then call me. That's what I do. Prescription drugs. All right. Anybody know the word formulary? Know the term formulary? Okay. Formulary is all prescription drug plans have a formulary. It doesn't matter if you're getting it bundled with an Advantage plan or you got a standalone Part D prescription drug plan. They all have a formulary. And the way to think about it is like a menu at a restaurant. So if you were to go to this restaurant over here, they have their menu. They've got chicken and lobster and steak on there. And then you go to this restaurant over here and they've got hamburgers and pizza and whatever. And they've got their own stuff. They've got their own prices. Same thing with the prescription drug plans. They've got their own menu. So the formulary is what's on the menu. And they come in tiers. They're typically 5 tiers. The first 2 tiers are generic tiers, preferred generics and non-preferred generics. And these are the ones where you go to the doctor you go to the pharmacy and it's a 0 premium or 0 copay or maybe a $5 copay. It's very little. Then you've got brand name drugs, tier 3 and 4 brand name drugs. Preferred brand name drugs, it gets more expensive. You show up to the pharmacy and it's about a $47 copay. Non-preferred brand name drugs, or even more expensive, might be a $100 copay. Those are getting to be pretty expensive drugs then. And then you get into the ultra expensive specialty drugs and they just quit doing fixed copays and they say, you're going to pay a percentage of the cost of the drug. And in this case, we're going to say it's 25%. Well, they also all work the same way as far as prescription drug Part D phases. So they begin in 2024. This is what it looks like, okay? Phase 1, January 1st, or whenever you enroll in the plan, is what they call the deductible phase. Now, you'll know that you're in the deductible phase because you're paying 100% of the cost of your drugs until you reach the deductible. Most common deductible on Part D plans is $545. Anybody know why? It's because that's the most that the government will allow them to charge. But there are Part D plans that have lower deductibles than $545. There are some that may have, I've seen them with a $150 deductible. I've seen them with $0 deductibles. The trade-off there, though, is that they tend to have higher premiums. So your 50-cent plan is not going to have a $0 deductible on these tier 3, 4, and 5 drugs. If you're paying a $100 premium on it, you might get one that has a $0 deductible. So there's trade-offs here with this. And it's a basic rule of insurance is that if they're giving you something with one hand, they're taking away something with the other hand, right? Now, once you reach your deductible, you're going to tip over into the second phase, and that's the initial coverage phase. That's where all of this stuff applies. All these copays apply. And most people spend most of their time in this second phase. They don't ever get beyond that. The third phase, when you reach a $5,030 in total drug costs, you're having a pretty bad year. Or you just got some expensive drugs. $5,030, that's not just what you're paying, but that's what you're paying plus what the insurance company is paying. $5,030 is the threshold that tips you over into the third phase. That's what we call the coverage gap. Anyone ever heard the term donut hole? Anybody know why they call it the donut hole? We don't either. But it changes the rules. And now, instead of paying these copays, you're going to pay 25% of the cost of your drug while you're in the donut hole. Not only that one drug, that the problem med that got you into the donut hole, but it's going to bring all of your meds with it. And you're going to pay 25% of the cost of all of your meds while you're in the donut hole. Now, let me explain give you a scenario of how that might happen. Let's say that you've got one of these preferred brand name drugs, and the retail cost on that drug is $1,000 every 30 days. So for the first time that you get the prescription filled, you're going to pay your $545 deductible, and the insurance is going to pick up the difference. So then in the subsequent months, you get the $1,000. About midway through the summer, you hit $5,030, and you tip over into the donut hole. Well, this whole time, you've been paying a $47 copay. But when you tip over into the donut hole, you show up at the pharmacy, and they said, it'll be $250 today. And you're like, whoa, what happened? You're now in the donut hole. And you're going to remain in the donut hole until your total drug costs for that year reach $8,000. That's called the catastrophic threshold. And at that point, you're going to tip over into the fourth phase, the catastrophic phase. That sounds terrible, doesn't it? It's really not, because when you're in the catastrophic phase, your insurance company is going to pick up everything beyond that $8,000. Now that you understand how that works, in 2024, we're going to mix it up a little bit, because all this is about to change. Anyone heard of the Inflation Reduction Act? Inflation Reduction Act. Notice it's written in red. If the government tells you that it's doing something, it's probably not. So someone in Washington, D.C. said, $8,000 is too much for you to be paying for your prescription drugs. We think that those big bad insurance companies ought to have to pay for everything above $2,000. Because no wonder $8,000 is $2,000 here. Woohoo! And they didn't ask the insurance companies what they thought about that. They just said, that's how it's going to be. So the insurance company is like, well, how are we going to do that? Well, something's got to give, right? If they give you something with one hand, they're going to take away something with the other hand. So what do you think some of those things might be? Well, it could be higher premiums. 50-cent premium goes away. It could be higher deductibles. In fact, we already know. I can tell you this: $545 will not be this deductible next year. It'll be $590. We already know that. It could be where your drugs land within this formulary. It could be what your copays are in the formulary. In fact, I already know that some of these fixed copays on Tier 3 and Tier 4 are going away. And they're just going to say, you're going to pay 25% of the cost of the drug when you've got one of these brand name drugs. And are your drugs going to be on the menu? The first question you ought to ask when you're enrolling in a prescription drug plan is, are my drugs on the menu? The second thing is, how much are my premiums and how much is my deductible? But your main concern is, are my drugs on the menu? Because as of, it's like a 2020 statistic that said that 47% of prescription drugs that were available on the market are not included in a Part D drug plan. So how do you know that? You're going to get a list of your prescription drugs. You're going to talk to your trusted independent Medicare broker, and you're going to say, hey, here's my zip code. What drugs are included in this Part D plan, or what Part D plans will cover my drugs? And there's a really neat computer model that we can use that helps to factor in all of these variables and figure out what is your prescription drug cost likely to be under any given plan during the course of a year. And then you can choose what plan is the best fit for you. Is it the 50-cent plan? Is it the $50 plan? It just depends. Depends on what your drug needs are. So remember we were talking about prior authorizations over there with the Advantage plans. You know they got prior authorizations for drug plans too? Your doctor wants to prescribe a drug to you. And the insurance company says, whoa, before we fill the prescription for that expensive drug, we would like to have a say in that. We're paying for it. There's another variation of this called step therapy. Anybody heard of step therapy? And this is where there's maybe multiple meds that might be designated for whatever your malady is. And your doctor says, I would like to prescribe drug C. And the insurance company says, that's great, but we would like you to try drug A first. And if that doesn't work, then you can try drug B. And if that doesn't work, then we'll let you prescribe drug C. Guess who's in control there? The insurance company. Yeah. Yep. I added something to this, which I think is really interesting too, and that is Part D exclusions. So what things are not included in Part D drug plans? There's certain categories of drugs that are not included. Barbiturates is one thing because of the potential for abuse. Benzodiazepines, those are like the anxiety drugs. Cosmetic drugs, so for skin wrinkles and hair loss, I'm out of luck. Not included there. Fertility drugs, like a lot of 65-year-olds need this. Sexual dysfunction drugs, even if it's prescribed, it's not covered. Weight loss and weight gain drugs, except for a diagnosed medical condition. And vitamins and minerals, even if they're prescribed. A lot of times I have people that they're giving me their drug list, and they'll say, well, I've got vitamin D or iron that's been prescribed by my doctor. That's not going to be covered. And then, of course, non-FDA approved drugs, they're not going to pay for anything that's experimental or iffy. It's got to be something that's approved. Now, there are exceptions for medically approved purposes. This little smiley face there. What are those? With Medicare, there's a but for almost everything, by the way. Smoking cessation drugs, those get paid for. Drugs to counteract severe weight loss in AIDS patients. Drugs to treat skin conditions. Now, that's different from cosmetic drugs. So, what's the skin condition? Eczema. Yeah. Okay, so that's different from cosmetic. So that would be covered. Cough medicines, things that have to do with conditions like asthma. And then drugs, this is the one everybody's interested in today. Drugs that are prescribed for a different approved use. And that brings up like Ozempic, and Wegovy. Yeah. So Ozempic gets paid for. Why? Why does Ozempic get paid for? Wegovy does not. Because Ozempic is prescribed off-label for blood sugar reduction for pre-diabetes patients. And so there's a medical condition that's associated with that. Wegovy, which is the very same ingredient, it's a semaglutide, is not paid for because it's labeled for weight loss. That might be changing because I was just reading this morning that they may have a medical application for Wegovy for some cardiac conditions. But as of right now, Wegovy is not paid for in there. Same stuff, just one is paid for one reason and one is not paid for that reason. Yeah.
Why hasn't Wegovy call itself a pre-diabetic drug?
I don't know. Good question. I think that if this thing I was reading this morning about the Wegovy being used for heart conditions, that might be their angle on that, but that's not been done yet. So as it is right now, it doesn't get paid for. So the important thing for you to pay attention to when you're getting your prescription drug plan is, are my drugs on the menu? I'll tell you a quick story about a lady last November. She contacted me. She was moving to Texas she had to undergo cancer treatments. She's turning 65. And I told her, you know what? No one would ever want you to get cancer. But in the Lord's mercy, this is happening on your 65th birthday because you were about to get the best insurance you ever had. Well, we put her on her Plan G. And I just talked to her today, by the way. That's interesting enough. Put her on her Plan G. And she called me back some months later because she wanted to get onto a dental plan. And she said, Rodney, everything that you told me was true. She said, I went to the doctor. The first time I paid $240 on my first visit. I've had chemotherapy. I've had radiation. I've had all sorts of things. And they've not asked me for another dime. That is powerful. That's the reason why you need to look real hard at that Medigap plan. If you look, we live in Houston. We have some of the best medical facilities in the world here. We've got MD Anderson here. If you want to go to MD Anderson with an Advantage plan, good luck. You're going to have a really hard time getting in at best. If you've got a Medigap plan, you're golden. In fact, you can go anywhere you want to, as long as they'll take original Medicare. You need to go to Cleveland Clinic, go to Cleveland Clinic. You go anywhere you need to. So it's portable. So if you're in another part of the country, you want to go see a doctor in another part of the country, you don't have to worry about the networks. You can go there. Just go. I found out that the best specialist in the world for my condition is in Ohio. I go to Ohio. I go there. Whatever. So the same lady, she got on the 50-cent plan. She was moving from California. Money was tight. Why do I need to be on a $50 plan? I've just got a couple of generics. Can I get on the 50-cent plan? I said, yes, you can. It was a perfectly good insurance plan. When she showed up at her first treatment, they gave her a $5,000 injection. Guess what? Wasn't on the menu. We scrambled very quickly to move her onto another plan. It was too late to save her from that $5,000 that they gave her. But the moral of that story is that if you know that you've got procedures coming up, go to your doctor and say, hey, doc, this is not your first time to treat this condition. What do you think that we're going to be doing over the next year? What are you likely to prescribe to me over the next year? And you get the list. She did this, by the way, afterwards. Get the list. Bring the list to your trusted independent Medicare broker. Let's look and see what plans cover the drugs that you're going to be taking and make sure that your drugs are on the menu. Yes, sir.
Good time to bring up GoodRx. You mentioned it earlier.
Yes, it is a good time. In the books that I gave you there, if you flip through those books, you're going to see there's a laminated sheet, and there are a lot of resources in there for how you can get prescription drugs filled. I mean, beyond just the corner drugstore. That's fine. By the way, there are two different kinds of drugstores. There are preferred drugstores and there are standard drugstores. You get the better deals at the preferred drugstore. So that's going to vary by plan. And there are also programs that are government programs that sometimes help people with drugs. There are sometimes charity programs that help people with drugs. Some of those are listed on there. On the back side, you'll see GoodRx listed on there among the discount cards. There's several others that are not quite as popular as GoodRx. You should check them out and compare them. Now, the one thing I really want to point out to you on here is the certified Canadian pharmacies. If your doctor will prescribe a drug, if it's very expensive here, it's hard to fill here, to a certified Canadian pharmacy, and keyword in there is certified. Okay, not just anything online, but they are regulated and they're certified. There's a whole list of them on there. All of those are certified. Then that might be an option for you. I had a lady today with a heart condition, and she was taking Jarden.
Priorities.
Yes. And she said, it's like $400 a month for me here. I can't afford it. And I went to one of these pharmacies and I looked it up, and she could get a 90-day supply for $180, $60 a month. So she's going to go talk to her doctor and see if her doctor will prescribe it. Sometimes they'll prescribe it and they'll say, well, I'll give you the script, but I'm not going to send it from my fax machine. So in that case, I'm not going to send it through my fax machine. But they'll give you a written prescription. You put it in FedEx, send it off to them, and you get it filled. Yeah. So there are other options. If you want to use GoodRx, you can use GoodRx, but you're going to be using GoodRx instead of your Part D plan. So anything that you buy with GoodRx is not counting toward your deductibles and toward any of those thresholds. By the way, those phases, if the $2,000 is the catastrophic threshold, the donut hole goes away. And that's going to be really good for some people. If you've got expensive drugs, if you cap out at $2,000, for many people, they're going to be maxed out in February. And everything gets paid for after that. Somebody else has got to pay for it. It's probably going to fall on the taxpayers to pay for some of that stuff. But it's going to compress those phases into 3 phases. So you'll have your deductible phase, you'll have your initial coverage phase, in which case many people were going to be paying 25% of the cost of their drugs, and then very quickly you're going to move into catastrophic coverage. We talked about the initial enrollment period. We're talking about 2 other enrollment periods, and we will call it good. The annual election period, and that's between October the 15th and December the 7th. If you can't remember those dates, it's okay. You'll know because that's when all the commercials come back on your television. You start seeing Joe Namath again. That is the time when you're going to change. If you're on an Advantage plan, it's the time you're going to change your Advantage plan. So if I'm working with you, I'm going to call you up. I'm going to say, hey, how's your plan working out? Let's take a look at next year's plans. Let's make sure that that's still a good fit for you. We're going to do that between October the 15th and December the 7th. Same thing with your prescription drug plan. If you need to change a prescription drug plan, then you can do that. You're going to make that change between October the 15th and December the 7th. Whatever you do between those 2 dates takes effect on January the 1st of the next year. This is very, very important for people who are on these Part D plans this year, because the plans are changing because of the Inflation Reduction Act. Stuff is going to move around. And you're going to get, if you're on one of those plans already, you're going to get an annual notice of change in September, because they're all required to send them out. But like everybody who's not an engineer here will throw that mail away. Only the engineers read it. We know you. We know who you are. I raised one. The rest of you will say, oh, it's junk mail from my insurance company. It's legal stuff. Throw it away. And you don't read it. And then you don't realize until you show up at the pharmacy on January the 1st, it's like, oh, wait a minute. Somebody moved my cheese. Something's different here. And at that point, it's too late to fix it. So we want to look at that. Tell all your friends who are on Medicare, let's look at your prescription drug plan during this annual election period. Very important. There's one other election period in here called the special election period. There's various flavors of special election periods, special enrollment periods. So when you retire, you get a special enrollment period. You're going to have a couple of months to get onto a prescription drug plan or to get onto an Advantage plan or to get onto your A and B. It's a special enrollment period because you're retiring. You're leaving your group health insurance. Another one that I think is really important to take note of is, remember these plans have networks? You're on an HMO plan. Think about it. You got a local network of doctors. They're looking at your zip code. And so if you moved outside of the county, or you move a couple of counties away, your doctors aren't going to be there anymore. And so when you move, you change your residence, you're going to tell Social Security, oh, I moved. And they're going to say, whoa, you're not where you're supposed to be anymore. You need a different plan. And they're going to give you a special enrollment period of 2 calendar months to make a change. So we're in August right now. If you were to move, let's say I moved to Florida, it'd be with my grandkids in Florida. Then I've got all of August, September. I'm terrible with the months. I'm counting backwards again. August, September, and October to get onto another plan. No problem. I contact my trusted independent Medicare broker and say, I need to get on another plan. They find another plan in my area. Now, how often does someone move because they get a serious medical diagnosis and they have to move to be closer to their family, or they choose to be closer to their family? Maybe they're like, I'm not going to move in with my kids, but I want to be closer to my kids so I can spend time with my grandkids. And at least there's somebody who can look in on me if I need some help. Happens all the time.
So, okay.
Yeah. Gives you a special enrollment period. That is one exception to this medical underwriting business. It's one exception to getting you from an Advantage plan over to a Medigap supplement, because it's going to be guaranteed issue during that 2-month window. No questions asked. Remember that. File that in the back of your mind, because that could be a lifesaver someday.
But that's when you're moving from one state to another state, not from one county to another county. Or
it's moving outside of your plan's network area. Now, that's not going to work for you. That's not going to work for you if you got a PPO that's got a national network.
Okay.
So there's some really good PPOs out there that have national networks. They're just going to say, oh, you can get another doctor in our network over in Florida. But if you're on an HMO plan and they're all right here in Houston, and you move to, let's say you move to Austin. Yeah, you moved to Austin. Well, that's going to take you outside of the area. You're going to need to get a different plan.
And that will allow you to get into Medicare.
Yes, it would. For some people, it would be. That's correct. For some people, it would be. It would make sense. And there's also a special enrollment period for natural disasters. So if we have a hurricane that blows through here and blows down 100 trees in your yard, then you're going to get a special enrollment period, because the government says, oh, you might have been preoccupied with getting the trees out of your yard during that time and not able to enroll in your plan. So if that disrupts your ability to engage in normal activities of the annual election period, then they'll get you a special enrollment period there. There's all sorts of things that you could get a special enrollment period for. Talk to your trusted independent Medicare broker. We deal with this stuff all the time. We'll find something for you. Any questions?
I saw it one.
Yes.
So you mentioned on the Advantage plan that it's guaranteed issue and emergency repairs provided.
Yes.
What happened with Medicare?
You need to go, you go. If you haven't paid your $240 deductible,
You have no issue with
Medigap is great.
And then what if I want to take a cruise at this 2 weeks over in the Mediterranean and I'm on Medicare?
I asked that question. I asked that question just for you. And the answer that I got was that there is what I had said before, and I'll say it for the rest of the class, is that with a Medigap plan, you have Plan G, you have limited emergency coverage outside of the United States.
Oh.
Yeah. By the way, some of these Advantage plans actually have some emergency coverage outside of the United States. But the Medigap plans have coverage up to $50,000 during a lifetime. They have a $250 deductible, and they will, that is applicable during the first 60 days that you're outside of the United States. That's really good. Now, if you're on a cruise ship, I get funny rules. Yeah. So the advice that I got about that was the same advice that I had given earlier, and that is just get a travel policy. Yeah, get the travel policy. Yeah, they're relatively inexpensive. They're very much worthwhile if you're on a cruise ship. The chances of you getting sick on a cruise ship are pretty high.
You had talked about premiums. Well, here is zero on Advantage. But the Medigap obviously is not going to be zero.
No, it's not. And let's just do some quick math on it. So let's just say this is $175 a month. And let's just say this is $150 a month. And let's just say this is $50 a month. And we hadn't even talked about the dental plan yet. I should talk about that. That's $375 a month. Do some quick math on that. That's about $5,000 a year. For a female, it's going to be a little bit less. And of course, I'm just giving you real quick numbers right here. It depends on the plan you get, and it just depends on your circumstances as to what that will be. But those are it's a pretty good benchmark to work off of. Dental, vision, and hearing. We talked about vision and hearing, and we talked about dental. There is one dental plan that I kind of like. Some people really want a dental plan. They're like, I've got bad teeth. I talk to people that have tens of thousands of dollars worth of dental work coming up. They know it's coming up. They want a dental plan, and we need to find them a good dental plan. Or they've been on a company dental plan forever and ever. That's how they work. That's how their mind works. That's what they're comfortable with. And they want a dental plan. One way or another, they want a dental plan. And most dental plans are not that great. They're going to say, we're going to cover you for 50%, I'm just making up something here, 50% up to $1,500 or up to $2,500. There's a plan I really, really like that covers 100% of routine doctor visit or dental visits from day one. Get your dental insurance. You go to the dentist the next day, get your teeth cleaned, get your x-rays, get your cavity filled, simple stuff. Covered 100%. All dental plans have a waiting period. Most all dental plans have a waiting period, and it's usually 12 months because they want you to get seasoned into it. Otherwise, people would get a dental plan and they would go get their root canal, and then they would drop their dental plan, and the dental plans would go broke. So they want you to keep their dental plan for a while and pay your premiums, and then they start paying for major stuff. It's usually 12 months. This dental plan after 12 months will cover 70% of major dental procedures. They cover 400 different major dental procedures. They cover 70% of them with zero deductible, and there's no maximum. You could literally have $20,000 worth of dental work done, and they will cover 70%.
How much do they start at?
$56.50 a month per person.
You said.
Okay.
Yeah. Husband and wife together, it's $110 a month. And if you have their Medigap plan, you get a 5% discount on all of that. Great. Any other questions? Okay. So in those folders that you got, there's a yellow sheet of paper. It's a class summary. Please fill that out. If you put your contact information on there, I will tell you, I will not pester you. So there's a fine line between pestering someone and neglecting someone when it comes to these sorts of things. If you don't ever want to hear from me, write on there, I don't ever want to hear from you, and you will never hear from me. If you do want to hear from me, then say, I want to hear from you. Please contact me, and I will contact you and follow up with you.
So, Robbie.
Yeah.
Okay, so I turned 65 in December. I was going to continue to work, and I'm going to keep my company, Sure Health Insurance and television. So is it true that then the Medicare will become my primary for my health? Or
So are you working for a company that has 20 or more employees? Okay, then you don't have to get onto Medicare at all.
I don't.
No. Save that $174.70 a month. Just wait.
But you pay the penalty for life.
No.
For that.
No, if she has coverage right now if she's got group health coverage, she works for a company that has 20 or more employees.
Okay.
You have options. If you want to get on the Medicare, if you're like, hey, you know what? $375 a month, I get really good Plan G coverage. I don't have to pay any copays, deductibles, deal with networks, any of that. You might want to do that. But you have options. You have choices.
So you have to register Part A here.
Only if you want to.
Part A.
Yeah.
Other sector.
Yeah.
You go in the Part A.
You're
because
in.
because he was under my insurance and he had to enroll in Part A.
Well, there's no reason for you to not enroll in Part A, except for the health savings account thing, and that doesn't apply for you.
Yeah.
So just go ahead and enroll in Part A, and don't check off I want Part B.
As long as you have the insurance for work, you don't have to enroll in Part B, and you will not be penalized.
That's correct.
So let's say I work into 66 and a half, then at that point in time, I submit the proof I was working.
Yep, it's the L564. You got it. You got it. Then you call me. Call me then.
Yeah.
Okay. That's the one thing I ask of you. I do these things for free. Whenever the time comes, call me, because that enables me to do this for people.
Because, that television and health, it's like, we're getting older. It's when you need coverage for your eyes. And it's like, now they just leave you on the pool.
I know. It's just not that great, though. Just go in and say, I'm paying cash. You don't have to have any special discount cards or anything. You just say, I'm paying cash. They give you the discounts.
That's I've been dreaming with my insurance company. My work. Getting all what I need to do.
Get your Dave Ramsey emergency fund to pay cash for these things. Okay, what else we got?
So, I already told you, so I'm turning 69, 3 weeks. I don't have any bond insurance. Do I need to get signed up for Part A? Or whatever?
Part A and B. Yeah, you need to go ahead and get on that. Go to ssa.gov. Yeah, and so, set up a profile if you haven't done that already on there. And when you get into your profile, you're going to see a couple of buttons in there. You're going to see one that says Start My Retirement Now. Don't click on that unless you're ready to start taking Social Security. Scroll down further, and you're going to see one that says Enroll in Medicare. And that's where you're going to do that. Go ahead and enroll in Part A and Part B. It's going to take Social Security about 3 weeks to get you a red, white, and blue card. When you get the red, white, and blue card, then that's your reminder. Call me, and we'll take it from there. We're going to go with one of these.
And then at this point, let's say I might have 3 months after my birthday to hit one of those.
Yeah.
And that will do both times.
Yep. You're not gonna have to worry about being late, other than you're not gonna have insurance. Okay. So you're fine. You're gonna be fine.
Right.
Don't sweat it.
I got a little delay.
Yeah. So if it's let's say that you're probably going to get a start date of September the 1st. But if it is beyond September the 1st, it's fine. We're going to start everything October 1st. So you're fine. Any other questions? Great. Thanks for coming today.